So today's session is on resident privacy, communicable disease policies, and physical property requirements for certification. I forgot to mention my name. I'm Danielle Gray. I'm the Executive Director for Ohio Recovery Housing, and I'll be leading today's training. And so today we kind of have this smattering of topics to talk about. First, we're going to talk about privacy policies and practices and what key elements of your privacy policies must contain to meet NARR standards. And next, we're going to discuss communicable disease policies and how these create a healthy and safe environment within your recovery home. And our final objective is a little bit different than the others. And so while it doesn't really flow with our other two objectives today, we did want to be sure to fit in information about the physical property expectations of the quality standards at some point within the Recovery Housing Institute. And this was the space where we had some time to do that. So we will be discussing physical property expectations as part of today's Institute session as well. So to dive in and get started, when it comes to privacy, one of the first things we think about are the laws that protect the privacy of individuals when they're seeking treatment or healthcare, because many residents of recovery homes are seeking some sort of clinical treatment services or other healthcare services. And so these laws do pop up into our minds as we consider recovery housing. And so while, myself, I'm not a lawyer, so I cannot give you legal advice. What we are talking about here today are NARR standards. I do feel it's important for you to be aware of these laws when you are considering the privacy of your residents, as well as in storage and handling of records. And so these laws are 42 CFR Part 2 and HIPAA. These laws may or may not apply to you depending on how your organization is structured and the specific services that your larger organization provides. So this is especially true if your organization is a part of a larger organization that also offers treatment services or other types of services for people with substance use disorders. And so this is one of those situations where you just need to get really good legal advice, because it's definitely going to vary depending on your specific organization, how your larger organization is structured, and the exact types of services that you provide. And so my hope for you today is to educate you a little bit on these laws and what they mean and how they might apply to you, so that way you can have a really good conversation with your legal counsel and keep billable hours lower, but there's no replacement for going out and seeking really good legal advice. And even if these laws do not apply to you, your organization, it's important to be aware of them, because you will likely be sharing information with other organizations such as doctors and treatment centers where these laws do apply. So having an understanding of how these laws impact your partners will help you be a more effective partner and ensure you're keeping resident information safe and that you're in compliance with any agreements you might have with these partners. And so the first law you should be aware of is 42 CFR Part 2. As recovery homes, you are not treatment programs. The recovery housing program should be separated from any treatment program, but you may come into contact with information from a treatment program or receive federal assistance for your program. You may also be a part of a larger multi-service organization that has access to specific types of information. And so it's best practice for you to protect any information and that you get legal advice about the types of information that you collect, where you get it from, and how it is used and stored. And so on this slide, we've provided some resources here for you. So a link to the SAMHSA guidance when it comes to 42 CFR Part 2, as well as information from the National Council of Mental Wellbeing. Both of these guidance documents give you an overview of the laws and how to determine if these laws apply to your organization. So I really encourage you to download these and read through these. And then it'll have very specific questions and analysis that are very particular to your individual organization, and you can use those analyses and then have a good conversation with your legal counsel. Again, our point here for providing you these tools is not to replace legal counsel, but to help you have really good conversations with them and hopefully keep the amount of time that you need to spend with attorneys low. And another law you might have heard about is HIPAA. Again, in general, recovery homes are not treatment providers and they're not healthcare providers. No healthcare services should be provided, by the recovery home or at the recovery housing property. And you do not provide treatment services within the recovery home. However, if you are part of a larger multi-service organization, or if you're receiving information from healthcare providers that you work with, you may want to familiarize yourself with HIPAA guidance. This can give you an idea of how best to share information with healthcare providers, both within and outside your organization. And again, there's a link to this slide to the Health and Human Services guidance on HIPAA. Again, it's best practice to look at those and see how they apply to your own specific organization and how it's structured, and then get solid legal advice from someone who can assist you with developing good policies and procedures, depending on which laws apply to you, when they apply, and how you should gather and store and share information. All right, so I've got a discussion question here for us, just to kind of wake everyone up and make things a little bit more interactive. And you can use the question box to type in your answer. So, how do you think that protecting resident privacy promotes the social model of recovery? So just go ahead and type in your answers. I'm not seeing any responses yet. So, all right, somebody said they're not really sure. That's fine. As a refresher for the social model of recovery, that's the model of recovery housing that we discussed earlier in the Institute, where we're trying to create an environment where people feel safe, where they feel supported, where residents are empowered. So how do you think that taking steps to protect resident privacy helps you develop that kind of environment? All right. Well, I guess it's a very good question because no one else seems to have a response. Oh, okay. So great. Somebody responded, it builds trust, which is true. I think that is probably the most important component. When a resident comes into a recovery home and they see that, whatever they share within the space will be protected and held private, and that people take all of that, seriously, it helps them trust you. It helps them build trust, with you as the operator, as well as with their fellow residents. So it's a really important tool for helping that as well. And so all recovery homes must follow the laws regarding privacy and confidentiality. So there's the whole, legal reason why you need to respect resident privacy. And of course, that is critically important. But even if there are circumstances where specific laws do not apply to an organization, it's still really important to take steps to protect resident privacy. So everything we do in recovery housing is about promoting that social model of recovery in recovery housing and building that trust. And so beyond just following the law, protecting resident privacy helps you create a safe and supportive environment for people to live in while they're living in recovery housing. And people might be coming to recovery housing from different circumstances. And when somebody has the ability to keep their information private, it can help increase their sense of safety. It also builds a sense of community. And so one of the biggest components of recovery housing is that we're creating a family-like environment where people live in the home and they create relationships that are close relationships and support one another. And so one big thing that families do is that they share things with one another, and that they share these private and personal things, which may or may not be healthcare or treatment related. But we also sometimes, within our families, we might share things with our families that we don't share with the wider public. We keep things private within our families sometimes because we have those deep, close relationships. And of course, if it's something where someone needs help, or there's a situation where you need to tell someone for someone's safety, then of course you do that. But sometimes we learn things that, we might want to keep private within our families or with our very close friends, and we do that. And so that having that, mutual understanding of privacy and keeping things, some things private can really help develop that family-like relationship within the home, and builds that trust not only with you, but also among the community. And so they know that they can trust you and know that they can trust those that they live with. And so when it comes to standards around policy, NARR standards around privacy, there are standards, and these are in NARR standards B.6. So these say policies and procedures that keep resident records secure with access limited to authorized staff, and policies and procedures that comply with applicable confidentiality laws, and policies and procedures, including social media, protecting resident community privacy and confidentiality. And so to meet this standard, you need to have a privacy policy that both sets expectations for your staff and volunteers, as well as sets expectations for residents. Again, sometimes we often think about, when we think about privacy policies, about our staff, like what is staff going to share or not share, staff going out into the community talking to one another. But we also need to think about residents who are going to be living together and learning a lot of information about other residents that they live with. And so setting those expectations for residents about what they can share and not share with others. So as NARR standards indicate, we also live in the world of the internet and social media. And so having good expectations for your residents regarding privacy is appropriate, especially when it comes to social media. Because what one person is very comfortable sharing on the internet might definitely be something that someone else is not comfortable sharing on the internet. And so just setting those expectations and letting people know off the bat can help you prevent a lot of issues. And so in order to address privacy and confidentiality among your team members, you consider the following: what information is appropriate to collect, how information must be stored, how information is used, and again, policies regarding social media. And so the first step in protecting privacy and confidentiality is limiting the amount of information that you collect. So I have seen many times recovery homes use applications from other programs, or they put unnecessary information on their applications or on their forms or things of that nature. And so if you recall from our last session on developing an appropriate application process, you should be limiting your application process and questions only to the information that you absolutely need to make a determination if someone is eligible or a good fit for your program. And so by really examining your application and other forms and materials you have people fill out, you can ensure that you're only collecting the information that you need to collect at the appropriate time. And that can help you limit the amount of information that you potentially have to protect. So also examine your other forms and documents and make sure that all the information you're collecting is pertinent for the purpose. So it's an extreme example, but for example, you don't need to collect your resident's social security number on a grievance form. So you are reducing the risk that that person's social security number would be exposed to someone else if you are reducing the amount of times that they're writing it down on pieces of paper. You may need that social security number for specific funding sources or for other purposes. And so if you need to collect it, go ahead and collect it. But there's no reason for it to be on the grievance form if you've collected it elsewhere. So you really take a look at all the information and be like, is this important for me to collect right now? Because the more pieces of paper and the more places that you have that kind of information, the greater your risk is of that information getting out. And also to ask the question, is there a better way for me to ask this question that for what I'm trying to get at? And so, for example, if your purpose is trying to see what services and supports a resident needs, you may ask a question about do you need additional services and supports? What other ways are you looking for assistance? Instead of asking, hey, do you have this specific disability? Yes or no. Do you have this specific healthcare condition? Yes or no. Because those are collecting two very different types of information. One is collecting health information, which might be considered protected, and the other is just going directly to what you're trying to ask, which is, hey, what services and supports do you need from me? And so that way we can see if we can provide those services and get those for you. And so I have a poll question here, again, trying to keep things a little bit interactive as we can. We will launch the poll here. So let me make sure. All right, yes, so the poll question should be on your screen. So go ahead and select an answer. Which of these is not a good way to store resident records? In a locked filing cabinet, on a password protected computer, in a locked desk drawer, or on a desk in an office that may be locked? So go ahead, I'm gonna give you about 20 seconds to select a response. Yep, so you guys are very smart. You all got it right. So out of these, the one that is not appropriate is on a desk in an office that may be locked. go. And so NARS, you recall back to the slide on the NARS standards, records must be stored appropriately. And so all paper records must be stored in a locked location. So this means a locked filing cabinet, locked desk drawer. Having them in an office that is locked is generally not sufficient because people may potentially enter that office and see records out in the office. So so yes, you can lock your office door, but all the records, should be placed in a locked filing cabinet, a locked drawer, some other sort of secure place. So that way, say you're in your office, you're working on something, you've got records stacked up, a resident could walk in or someone else could walk in to meet with you and they see all these records. So in general, having that locked storage as well as a policy in place that's like, hey, the records go there, they stay there. You don't leave records outside of the locked space. And then also it's important for electronic records, they be stored on a password protected computer. So many people just use electronic records now. And so you want to make sure that those are password protected and that only authorized staff have access to specific electronic records. And the next component of your privacy policy should provide details on if and when you will share any information that you learn about residents. And so, for example, do you plan on sharing information with their treatment provider, parole officer, or members of their family? And it's a really good idea to be specific. And so, for example, you might tell a resident you will share information about results of drug screens, attendance at house meetings, and such with a person's parole officer, but you're not going to be sharing specific information shared during, your conversations on their recovery plan. And so they know that it's like, hey, this person is going to know what the results of drug screens are. They're going to know if I'm showing up to house meetings. They're going to know if I break the rules. But when it comes to me sitting down and talking about my recovery plan or what I share in house meetings about my personal life, like those things aren't going to be shared. So they can still have that sense of privacy. And of course, this is going to be very specific to your organization because depending on, where your referrals are coming from and different agreements you have with different organizations that you partner with, you might need to share different, or they might be expecting that you share different information with them. And again, all of that's okay as long as this is disclosed to residents and they agree to it and they sign off knowing that that information will be shared. And of course, you might want to consider situations where you are going to be legally required to share information, such as when you're compelled to by a court. So you can let residents know that, like if we ever get a court order that says we have to share the information, we will be sharing that information. And you will, be in compliance with any court orders. And the residents may also want you to be able to share information with family members or others. And at this point, you should have a process for documenting that you have the resident's consent to share information for others. And the next important thing is to consider, emergencies and other specific scenarios. So when you're letting your residents know, like who you may share information with and why, it's important to have policies to think about emergencies or other specific scenarios. So for example, someone calls the recovery home looking for a resident and wants to verify that they live there. Now, what would you do in that situation? Would you, confirm that? Would you not confirm that? You have to think about how you would handle that specific situation. In most situations, you're going to say, nope, that's not information we give out unless you have that release of information to tell that individual, like say their parents are like, hey, is Danielle living there? If I've signed a release of information that says you can share information about me with my parents, then yes, you can be like, yes, Danielle's living here, she's still living here, all of that. Then think about emergencies as well. So if a resident gets into a car accident, is not able to speak for themselves, and so somehow they get your contact information and they call you looking for information about the resident, like what are you going to share? What are you going to say? And then also a resident experienced a medical emergency at the house and is taken to the hospital. Those types of emergency situations you want to think through, like what, and then of course just tell residents, this is how we're going to handle these situations. And of course, finally, seek legal counsel to make sure that you're in line with all of the laws and what you're required to do under laws and how they apply to your particular organization. And then while it's critical for you and your staff to have appropriate expectations regarding privacy and confidentiality, it's also important that residents understand these expectations as well. And you can have a separate policy regarding privacy for residents, or you can add items to your code of conduct. We had our training on residents' codes of conduct earlier, and so you can add some statements to your code of conduct about promoting privacy. It just needs to be clear to residents that when they are living in the home, they know what they can share and not share about others living in the home and why it's important. So for example, if someone stops by the recovery home or runs into a resident at work or at the grocery store and says, hey, you live with Jane Doe, right? How do you want them to respond? In the moment, it might seem harmless, especially in small communities where people might feel like, hey, everyone knows everyone else's business anyway, but they might actually be compromising that individual involved or violating their sense of safety or privacy. And also residents may have visitors to the recovery home. And so it's a good idea to ask residents to request that their visitors also respect the privacy of others, or even perhaps include that information in your visitor policy, where like when visitors arrive at the home, you just ask them like, hey, this is a recovery home. You might see someone here or meet someone here. We ask that you keep anything that you overhear, anything that you might see here, private. Because they might see another resident in the kitchen while they're visiting the home or something of that nature. And then finally, social media is everywhere. And it's a good idea to talk about what's appropriate to post on social media, such as photos of other residents, the location of the house, and things of that nature. And certainly as well for visitors, just making sure that they're aware of your privacy policies as well, and asking them also to keep information private. All right, and here are just some examples for your code of conduct as you're developing that. And these are just written in a way that, again, we want residents to agree to the code of conduct. So, really just explaining, why, the residents must, keep things private, and having that language set out for you. So it's just some examples that you can take. A part of keeping everyone in the home safe is respecting privacy. And so therefore, I will not share information about others in the recovery home without their permission. If someone calls the home or asks me if a particular person lives at the home, I'll direct them to the house manager, or you can say, or the resident director, whoever the appropriate person is. And I agree not to post photos or other identifiable information about others on social media. And so, just these simple statements, you can go over the code of conduct before someone moves in, and they can, know and agree to these things and just be aware of them to help avoid future issues. All right, so I'm going to pause here to see if there are any questions about resident privacy policies or what we've discussed so far. Go ahead and type it in. Okay, I'm not seeing any questions, but if you do come up with any, please do type them into the question box. I'll be pausing again and looking back so we can answer those as you have them. So next topic for today is communicable disease, which I am sure we are all sick and tired of, because it seems like everyone has a cold, the flu, COVID, something, RSV, whatever it is, in December around the holidays. So I'm sure we are all sick of talking about it. And I'm sure we are definitely all sick of talking about COVID-19. But we have always required communicable disease policies for recovery homes, and certainly we need to think about more than just COVID-19, because many people in recovery do have complex health conditions, and they may have communicable diseases. And so you want to make sure that your living environment is as safe and healthy as possible when it comes to communicable diseases. And just going back to our previous sessions, as a reminder, recovery housing is housing. When you are welcoming people into the home, you are only asking information that you need to determine if they can live in the home. You cannot discriminate against anyone who has a particular disease or a condition. And so we recommend not even asking for this information, because it can be seen as potential discrimination. So for example, if you ask on an application, do you have HIV/AIDS, and then later deny someone housing, you might get into legal issues if they're like, well, I told you I had HIV/AIDS and then you denied me housing. Did you deny me housing because I had HIV/AIDS? So don't even ask that question on your application, because there's no reason why you need to know that particular information in order to make your determination about whether or not that person should get housing, because you are legally not allowed to discriminate against people who have medical conditions or disabilities. That will certainly be a red flag for any legal issues, and we certainly want to help you stay out of those. And so you may not know if someone has a particular illness. You may not know if someone living in your house has hepatitis, HIV, or any other sort of communicable disease. And of course, if they choose to tell you, you can keep that information private, and ask how you can support that person and refer that person to appropriate healthcare. But they may not choose to tell you. They may have the ability to keep that information private. So I know for many people, this might cause a little bit of panic. Like, well, what can we do? Like, what can we do to keep everyone in the house safe, knowing people are living in close quarters, if we might be welcoming someone into this unique living situation who has one of these health conditions? And so what you can do is make sure you practice universal precautions at all times. So you can educate yourself, your staff, and your residents to take these universal precautions. And so if you're consistently implementing universal precautions, you don't have to worry if and when a resident discloses to you that they have a communicable disease like hepatitis or something, because you're already taking all the needed steps to stop the spread of illness at the home. So you do not need to tell anyone, because everyone's already aware of the house's practices on stopping the spread of illness and are taking action to stop the spread of illness. And your communicable disease policy should be clear to residents that they have the right to keep their health conditions private, and that others in the home have the same right. So just sharing with people when they move in, like, hey, we are not asking you to share with us like any information about, any sort of healthcare conditions that you might have. Just so you're aware, we don't ask anyone else either. So you could be living with someone who has a healthcare condition, and therefore we recommend that you take these steps at all times, because you don't know. And this is how you can keep yourself safe, and how we can keep everyone in the house safe, and and living together in a healthy environment. All right, so another poll question, just to keep things interactive here, help wake you up on this cloudy day. At least it's cloudy here in Columbus. All right, so which of the following are good strategies to reduce the spread of illness? Regular hand washing, cleaning regularly, staying away from others when sick, not sharing personal items, or all of the above. So select the most appropriate answer, and I'm going to give you about 20 seconds. All right, so technically you all got it right, because it was all of the above. So all of these are good strategies for reducing the spread of illness. So some of you just selected hand washing, but the others, so you're not wrong, because hand washing is a good strategy to prevent the spread of illness, but so are cleaning, staying with others when sick, and not sharing personal items. Okay. All right, so the first universal precaution that many of you selected was washing your hands. And so this is why for ORH, we require that hand washing supplies be present in the home, and we encourage recovery housing operators just to include the cost of these supplies within their rent and to provide them to residents. It can be a struggle, like you can tell residents that they need to purchase their own and that they always need to be available, but people will share the bathroom, and oftentimes we go into homes that have that policy, and there's no soap or hand sanitizer or anything in the bathroom at the kitchen sink, and it's because no one has spent the money to purchase it. So we just recommend including within your budget that you're going to buy hand soap and supplies for keeping people's hands clean after they use the bathroom before preparing food in the kitchen. And so just, again, let residents know the expectations that they're going to wash their hands after using the bathroom, before cooking and handling food, when arriving or leaving the home, and then after sneezing or coughing. And so this is where it could be helpful to, again, keep those supplies stocked, but then also keep, hand sanitizers in places where, it's common to maybe keep hand sanitizer at the kitchen table, so that way people can quickly clean their hands before eating, that sort of thing. And so some people post signs as reminders as well, again, just ways to get people into a regular habit of washing hands and making sure that your hands are clean. It's a good way to stop communicable disease, and especially if people are cooking food and sharing food with one another, washing hands before cooking can stop the spread of foodborne illness as well. And the same thing for cleaning supplies. Ensure that your cleaning supplies are appropriate and well stocked. When we do our on-site visit, we'll be checking to make sure, again, that there's hand washing supplies, but that there's also cleaning supplies present. And then you can have checklists of daily and weekly chores. There's just a list here of like the basic chores that should be done. Wiping down surfaces like counters, cleaning out the refrigerator and freezer. Great way to prevent foodborne illness is making sure any food that's gone bad is thrown away, and any spills or things that may have leaked are cleaned within the fridge. Dishes are washed and put away. The trash is taken out. The bathrooms are cleaned. The sinks, toilets, showers, and tubs are clean. And then you have a schedule to make sure residents are washing their bedding and towels, and that you're sweeping and mopping the floors. And then, of course, you can have these chore lists, but there needs to be, need to check to make sure that it's done. And many recovery housing operators recommend that this is a good way to ensure resident leadership. So you can have a senior resident who's in charge of, making sure chores are done. And of course, I know many people are like, well, what if the power goes to their head? Well, another suggestion I've heard is to rotate who the senior resident is among residents who have lived in the house for so long. So like, say once you lived in the house for 3 months, you're on the rotation to be the senior resident. And the senior resident's responsibilities might be checking in with people at curfew, making sure chores are done. And so for 2 weeks, you're the senior resident, but then you also know what it feels like when someone else is the senior resident for 2 weeks. And that helps people learn those skills about, what it is to be a leader and how to do things effectively and learn from one another. So, that's a great way to make sure it's not your staff doing things, making sure that the house is clean, but you're developing resident leadership and having them, help you and make sure that the house is clean. Or if you can appoint someone who's in the home who's just really into having a clean environment, and they're the one in charge of creating the chore chart, making sure things get done. It's up to you. We just want to see that there's a process, that you make sure that chores are getting done and someone's checking to make sure that things are done and that supplies are stocked. So, and then again, provide the supplies to residents to keep their personal areas and belongings clean. So again, just build into your budget, like many recovery homes just build into the budget that they're going to be buying laundry soap. So that way residents can wash their personal sheets and towels and clothes. They're going to be, buying the mop and the vacuum. So that way residents have those items and are able to, to not only keep the general house clean, but they can keep their personal space clean. And another way disease spreads is through sharing items like glasses, razors, toiletries, or utensils. And so, of course, residents will soon feel like they're living among family, and families sometimes do things like that, or just different people. Sometimes they're like, I don't care, I'll drink out of the same cup as you, or sure, I'll try a bite of whatever you're eating. And, or you leave items in the bathroom and you can't find yours, so you just pick up someone else's makeup brush or whatever it is. And so it's important to tell residents that they still need to be careful, because it could lead to illness, and again, you don't know the individual health history of everyone living in the home. So, and so a strategy that works for some is to give residents their own caddy for their personal items. And so they can bring the caddy with them to the bathroom when they need a shower, get ready for the day, and then return to their room. Or you can have a shelf in the bathroom where everyone puts their caddy, so that way you know which items are yours. You can take them out of the bathroom to keep them clean while other people are showering or whatever. And that way, these items are not in the bathroom when another resident is using the bathroom, and reduce confusion. You can also buy items like toothbrush covers and other items that can be helpful keeping the items clean in a shared bathroom setting. So those are just strategies to help residents decrease the amount of times that they're sharing items. And then the chore list will also help. If there's plenty of clean dishes, you're not going to be sharing dishes or utensils. And then also universal precautions around bodily fluids. Life happens in a recovery home. And as much as you might want to try to prevent an illness, sometimes people get sick. Residents might cut their finger while they're cutting dinner. And so instruct residents to use gloves when cleaning after such incidents, and provide them with a basic first aid kit that has appropriate bandages as well as gloves, so they can keep cuts or wounds that they have clean and unexposed. And so if someone does cut their finger, they can cover that, and then there's gloves there, so that if they're going to go prepare food, they can put on a pair of gloves now because they have that wound, and you're making sure you're keeping everybody's food safe. And so just having that be on that checklist of things to check every once in a while, making sure that first aid kit is stocked with appropriate bandages and gloves and things of that nature. And also, if someone is not feeling well, you can ask them to take the following steps. So cover any coughs or sneezes, so that way they're not needlessly spreading illness, and ask them to stay home. I know this means that they will not be leaving the recovery home, but when you're sick, you shouldn't go to work or school if you're feeling unwell. And that, we learned a lot about that with COVID, but also, there's RSV, the flu going around. No one wants to be sick with anything. So just having somebody stay home, not spread the illness in the wider community, can help keep everyone safe. And there's lots of virtual options. So if someone is feeling unwell for a few days, we've learned so much about leveraging technology as a way to connect. And so, you can have for a couple days somebody attend the weekly or the daily meditation or the daily check-in or the weekly house meeting virtually from their bedroom or something like that, just so that way, they can temporarily, until they feel better, avoid others and keep everyone healthy. And then don't hug or shake hands while you're not feeling well. So that way, you can reduce the risk of spread of illness, and just kind of keep that 6 feet of distance just while you're not feeling well. And then finally, contact a healthcare provider. So if people aren't feeling well, you don't know their health history, you're not their physician, so you can recommend to them that they contact their healthcare provider and make sure that they're following their instructions for everything that they need to do to get better. And another great way to prevent illness is to encourage residents to stay up to date with their healthcare appointments and preventative care measures, such as vaccines. And so as a recovery housing operator, you're not a doctor or nurse, so you can't give them medical advice, but you can encourage them to make an appointment for an annual checkup and encourage them to follow doctors' recommendations for preventative care and screenings. And so if a resident does not have a primary care doctor, you can connect them with a locally federally qualified health center, or help them contact their insurance company for recommendation that is on their insurance plan. And there's information here on getting the COVID-19 vaccine, and there's other vaccines that are available with from your local health department. But this is a great way, just encouraging residents to establish that relationship with a primary care provider. I mean, not only for infectious diseases, but they can also tell residents screenings and things that they should be doing to help detect and prevent chronic healthcare conditions as well. So it's just a general healthy thing to do to try to help them get connected to that healthcare provider and build a relationship, so that way they can stay healthy on all fronts. And then finally, many of you have built great relationships with your local health departments in the past couple of years, and we just encourage you to keep this relationship going. There are great resources for lots of local health information. So for example, right now in Central Ohio, there is a measles outbreak. And so our local health department is sending out lots of information about measles and signs and symptoms and where to go and what to do and how to prevent the spread of measles. And that is going out to a lot of organizations within the Central Ohio area, and I also believe statewide, because they don't want the things to spread and go statewide. So, so just having access to that information can help you monitor what's going on within the larger community, as well as connect to resources when they're needed. And they also provide training, best practices, and just lots of great information on prevention. They do vaccines not only for COVID, but for flu and for lots of other diseases. So they're just great partners to have locally and to sustain a partnership with. And so to wrap up this section, when writing your communicable disease policy, ensure that your written policy includes that residents can keep their health conditions private. So what precautions residents can take to prevent the spread of disease within your home, and that residents are provided with the supplies and tools to take such precautions. So there is a sample communicable disease policy in the Recovery Housing Development Guidebook, which is in our handout section. So you can go ahead and download that and see a template. And then, like we said, there's a lot of information we talked about in the last half an hour related to communicable disease policies. So you can review that and learn, you know, and adjust it for your own individual organization. All right, so I'm going to pause here again for questions. All right, and so I've got a question here. It looks like this one's going back to the privacy policies. Can a resident guest sign a code of conduct or sign a confidentiality form? And yes, that is something that you can implement. We do not require that people do that. We require that people have codes of conduct for their residents, and we require that you have a visitor policy. But it is up to you and your organization if you want to ask that all visitors sign a code of conduct or sign a confidentiality form. And again, you just the constant thing that you're going to hear from me, I'm like a broken record. Just make sure you also contact your legal counsel to make sure that that things are written appropriately and what laws apply to you and how you have to phrase things. All right, and so it looks like if you are having issues downloading the handouts, just send me an email. My email address is on the slides here too. You know, I can get you a copy of things after the webinar. So if GoToWebinar is causing issues with you downloading handouts, I see a question about that. All right, I'm not seeing any other questions, but go ahead, type them in, and you know, we will, you know, be pausing again. All right, and so this is one where we're shifting gears a little bit away from policies and talking about the physical property. And the physical property is an important element of consideration. You know, a lot of this institute is about, you know, your policies and your procedures, but of course your physical property matters. And so we're hoping that the following slides will provide more information on what to look for as you evaluate a property to be a recovery home, or considering the physical property improvements you may need to make to a property that you already have. And one of the biggest considerations is the neighborhood. When choosing a neighborhood, look for one with opportunities for your residents. So you will be helping residents get jobs, get connected to services, and also helping them find ways to enjoy life and have fun while in recovery. And this can be easier if you're located in a neighborhood that is safe, has access to public transit, easy access to services, job opportunities, as well as amenities like parks, restaurants, and other ways for people to enjoy their time. And so we do not have any requirements about what types of neighborhoods recovery housing can be in. You can open a recovery home in any neighborhood. We do not have any requirements around it being so much of a distance away from, you know, anything specific. You know, we want recovery homes to be in residential neighborhoods and areas of opportunity. But we also want recovery homes in all sorts where people can find them and meet people where they're at. And so you just need to look at the neighborhood and consider, you know, if you are in a neighborhood where there's a lot of drug activity going on, you know, what additionally do you need to do to protect your residents from that, and to implement policies and procedures and programming to counteract, you know, what's, you know, going on the outside. You know, if you do have a liquor store on the corner, you know, what are you doing, you know, about that, and just being aware of your environment. And the same thing to you, access to transportation is huge. We know in our rural communities that just might not be possible, but just really looking at what are the opportunities for people, because we know that many people in recovery, in very early recovery, don't have a driver's license. They don't have a way to get around. So how are we going to help them get a job, get somewhere if they don't have access to transportation that may not be available in your community? And so one of the most popular questions that we're asked is about space. And there is no set requirement for total square feet needed in a home, but there are several quality standards that relate to the total space within the home. And so the first is that you need one toilet, sink, and shower for every 6 people. And this counts so if you are a body who sleeps at that home every night, you count as a resident. And so if you have a staff house manager that sleeps at the home, they live there, they use the bathroom, they count as a resident. And then once people are over a year old, so like children, once you're not babies, infants, they use the bathroom. And so that counts as a person living within the home, and you need to have one toilet, sink, and shower for every 6 people who are living in that home, sleeping there, using the bathroom. Also, bedrooms are 70 square feet for the first person and 50 square feet for each additional person. I know the NARR standards say 50 square feet per person. Ohio has gone beyond that to align with the quality housing criteria that is set by the Ohio Department of Mental Health and Addiction Services. So you do need that extra 20 square feet for that first person. And so this would mean you need 120 square feet for a double bedroom, 170 square feet for a triple bedroom. And we do not have a maximum number of people per bedroom, but it is highly recommended that you do not go over, over 3 people in a bedroom, because then it just starts feeling more institutional. It's allowable, you're allowed to do it, but we don't want to see rows and rows of bunk beds in sleeping areas. It gets really hard to, have people feel like they're in a home as opposed to an institution once you start, stacking, beds in a room to cram people in a room. So, and then it's hard to maintain privacy and to get people to stay in recovery housing. You might stay longer if you only had 1 roommate versus if you had 6 roommates, right? So it's something that we encourage, but there's currently no set requirement on the bedrooms. You would just have to see if you can balance having that many residents while also maintaining the home-like environment. And then finally, living room, dining room, common areas large enough to hold house meetings and entertain. So if you have enough bedroom space to house 12 residents, that's great. But if you have a tiny little dining room where only 2 people can sit and have a cup of coffee, your house is not big enough. You need to have a dining area where people can sit and share a meal together. Remember, we're creating a family-like environment, and the number one thing families do together is eat together every once in a while. And so we want to see that dining area there's some place that has table and chairs that's big enough to hold everyone for to share a meal together. And the same thing with the living room. The living room needs to be big enough to have a house meeting. You're going to have at least weekly house meetings. So big enough to have everyone come together and have a house meeting, watch a movie, socialize. So even if you have X number of bedrooms upstairs and you can fit 10 people, if only 8 people can fit at the dining room or in the living room, you're going to be limited to 8 people. And then 1 refrigerator for every 5 residents. That is 1 full-size fridge. And there is some leeway, if you've got one of those super huge commercial refrigerators or something of that nature. But I mean, this is where you just have to be reasonable. If the square footage is twice as large as a standard fridge, that counts as 2 fridges, but it does need to be 1 full-size fridge for every 5 residents. And then dry food storage in the kitchen. And so what we don't want to see is residents, not having enough room in the kitchen, so they're storing food in their bedrooms. So we want to see that your kitchen is big enough to have that appropriate amount of dry food storage. And then if you need a second fridge, that does not absolutely need to be in the kitchen. It can be in the dining room, it can be in an attached garage, it can be in the basement, but it does need to be somewhere where residents can easily access it so they can get their food. And we're also often asked if apartment buildings can be recovery homes. And yes, apartment buildings can be recovery homes. This housing type can be great for special populations like families. So we encourage people to try to start recovery housing within apartment buildings, just because it is so great for families. However, there are particular considerations when it comes to your practice of like implementing a recovery housing model within an apartment. You need to be sure that there's still a common space for people to gather and socialize and have fun. So the space must be furnished and welcoming and large enough to hold all of the residents. So remember, we need to see evidence of the social model and that people are not just hiding in their apartments all day and not interacting with anyone else or giving or getting support from each other. So an apartment style model is very much possible, but you need to be extra tempting to get people to come out of their apartments with activities, meals, house meetings, classes, things of that nature. So that when people are leaving their apartment and they're coming downstairs for movie night on Friday, or they're going to have pizza on Wednesday or something like that. So that way you get that community, you get that interaction, and residents are networking with one another. They're not just meeting with your staff and then going to their apartment. That's not something we want to see. And so your apartment building does need to have that common space. And either the common space is already built in, which is great, or some people, if they have a larger apartment building, they may leave an apartment on the first floor open, and then they use that apartment as the common space, like the living room and stuff, as the common space for the building. You can be creative about it, but what we don't want to see is a space where all it is residents going into their own individual units, and there's no space for people to gather to build relationships with one another and advance the social model. And so for the outside of the house, we want to see that the house yard is free from trash and debris, it's well maintained, and if smoking is permitted, it can only be permitted outside in a designated area, and you have appropriate containers for any discarded cigarettes or things like that. And so no smoking in attached garages or things like that. It's a fire safety issue. We don't want to see the garage lighting on fire and then the house lighting on fire. So even though it's cold out, residents will have to leave the building in order to smoke. So that way you make sure your house does not burn down. Cigarettes are one of the most popular reasons why there are house fires. So we want to definitely prevent that. And we want to see that any outdoor buildings are good repair and safe, and the same thing with any fences or anything like that. So if you have a shed on your property and it's collapsing and falling apart, we would have to ask you to remove that, in order to get certified. And the same thing with fences. It can't be a safety hazard to have a fence falling apart, or things like that in the yard. And then furniture. You will need to furnish your home. And so when considering furniture, select furniture that is typical for a single family home as opposed to an institution. And you also need to set up the space to encourage residents to use the space for leisure and other activities. And so furniture needs to be in good condition and used for its intended purpose. So don't use old office furniture as bedroom furniture. Don't use outdoor tables and chairs in dining rooms. And don't use old sofas or office chairs as outdoor furniture. We want to see all the furniture is used for its intended purpose, and that it is appropriate for a home as opposed to a doctor's office or a prison or a homeless shelter. All right, so just a little bit of an activity, and I apologize, this photo is a little bit grainy, but if you could just take a look at this photo and let me know what you see. What issues would you identify for this recovery home in this photo? All right, somebody's got to have a suggestion of what. All right, stuff lying around the house, correct. A lot of stuff lying around the house. Yep, trash, it's cluttered, there's overgrowth of trees. Yeah, so the main thing is that there's a lot of trash here around this house. It looks like it's blocking the garage, which might be a potential egress, things of that nature. So, if this were a recovery home, we would definitely recommend that they clean up, the trash and the debris in the yard, and make sure that any egresses, such as the front door or else, aren't blocked and that they're in good repair and safe so people can leave. So yeah, just a little exercise to see what we've learned in previous slides. And so continuing with safety. For safety, you should check any potential any potential building that you're looking to purchase for any potential safety hazards. And we recommend having an inspection done by a building inspector prior to purchase. So whether if you're purchasing, whatever type of home you're purchasing, if you're purchasing a single family home, have a home inspector come and look at that. And so you can know what needs to be done from a safety perspective. And also ask them about the condition of essential items like furnaces, water heater, air conditioning units, sump pumps, the roof. Especially if you're looking to buy an older home, check the electrical system and see if it's appropriate for the house. So you really want to get like a trained, certified inspector before you buy a property, or even if you're going to be leasing a property, just have somebody come and take a look at it and note any potential safety hazards or things before you go and purchase anything or spend any money. And just know that you are required to provide safety equipment for the property. All homes must have smoke detectors in each sleeping room and in the kitchen. That smoke detector in the kitchen needs to be placed somewhere, so that way if like somebody leaves something on the stove or in the oven and it starts to burn, smoke detector is going to go off before it's a huge fire issue. You'll also need fire extinguishers in the kitchen in a place that's easily identifiable and labeled, so that way, again, and it needs to be somewhere where it's easy, like if something lights on fire in the stove, somebody can quickly grab it and put that fire out. And you also need carbon monoxide detectors, and we need to see carbon monoxide detectors that are placed within 15 to 20 feet of the appliance, and they just need to be placed according to the manufacturer's instructions. So some people have them hardwired in, some are made to be lower to the ground, they need to be other places. But the point is, for the carbon monoxide detectors, is that they're installed according to the manufacturer's instructions, and that they're placed in a way where if there is a carbon monoxide leak in the house, the alarm will sound and residents will be notified even if they're sleeping. And so for most homes, this is going to mean placing at least one carbon monoxide detector outside the sleeping areas. So that way that alarm will go off and residents will wake up. Having it in the basement when all the residents are on the second floor may not be helpful, because if you're sleeping, you may not hear it go off. So that's the whole point. Install them according to the manufacturer's instructions. You can buy ones that are the best for your home. Put them wherever the manufacturer says they should be put, but just make sure that if they go off, it's going to be loud enough, residents will hear it, they'll wake up, and they'll be able to leave the home in time if there is carbon monoxide. And then naloxone must be available in the home. So that must be placed in a common location. So having naloxone in the locked office is not appropriate. You need to have it in a common location where people can access it in case of an emergency. It can't be locked up. You got to have that out and available in case anyone needs it quickly. And then when it comes to bedrooms, we already discussed space requirements, 70 square feet for the first person, 50 square feet for each additional person, but each resident must have a bed that is made for sleeping. So no using temporary things like air mattresses or sofa beds. Each bedroom must have an appropriate door. So this is something that we've been more strict on in the past couple of years. We put this requirement in 2020. It's still there, but I highlight it to make sure everyone knows. So there must be an appropriate door, so that way residents can have some sense of the trauma-informed environment. And again, we were talking about privacy. If they might have a roommate, but again, it's different to be like, oh, I need to go change or something like that when you have one roommate versus you've got 16 roommates and everyone can see you go in your bedroom and change your clothes. So you want to make sure there's an appropriate door to the bedroom and that each resident has storage space. So there's a place for them to put clothes that they fold up, and that there's also a place for them to hang items. And there must be a fire detector within the bedroom, within the sleeping room. So having one within the hallway outside all of the sleeping rooms is not enough. They need to be within each sleeping room. That is a very clear standard from NARR. And so if you don't have one in each sleeping room, we'll note it and we'll make you put one in. And the resident does not need to travel through the bedroom to get common areas of the home. And so what we mean by this is pretty much don't turn your living room into a bedroom. Because we don't want to have a resident have to have, somebody wake them up in the morning because you need to walk through their bedroom in order to get to the kitchen. They should be able to sleep, and that resident who needs to go to work early should be able to get up and go to the kitchen and not, bother that other resident. So that's what we mean when we say they don't need to travel through to get to a common area of the home. So the same thing for like laundry areas or things like that. I shouldn't need to walk through a resident's bedroom in order to get to the spot to do my laundry, because then people will be constantly going in and out of that particular person's bedroom just to do their laundry. So this really just helps promote a trauma-informed environment. And so that way people, again, they have that, it's supposed to be home-like. They have that sense of they have their space, and that way they can have that own personal space and have their privacy and things protected as well. And so our recommendation, it's a very strong recommendation, is to avoid bunk beds whenever possible. We had a big discussion about this with the ORH Board of Directors, and this is a part of our equity advancement work. We know that there are a lot of people with disabilities, and having a bunk bed situation is not helpful for a person with disability or older adults who may have physical limitations, getting in and out of a bunk bed. And so we really, and also the second part too is that bunk beds are commonly used in very institutional environments, in prisons, in homeless shelters, in treatment centers, and things like that. So we want to ask that people avoid bunk beds whenever they possibly can. So if you are establishing a brand new recovery home, don't buy bunk beds. Buy single beds, just to promote dignity of individuals and to keep that home-like environment, as well as to be more accessible and equitable for older adults, people with disabilities. And I guess I'll put the caveat in here, like bunk beds are appropriate for children. Children sleep in bunk beds all the time. So if you're going to have a recovery home with kids, yes, certainly have a bunk bed. That's fine. I'm talking about bunk beds for adults. So, and if you are running a recovery home and you have bunk beds, we just really encourage you to think about phasing those out when it comes time to replace your furniture. So that way, you can, promote equity and promote that home-like environment. Again, not a requirement, but a very strong recommendation. All right, and so another activity for you all, trying to keep you awake. So can you tell me what you see in this photo? All right, yes, I'm seeing a lot of good comments about this space. So it's very cluttered. There's a lot of stuff. The beds, there are 3 beds here, and they all look too close together. There's these sideways dressers that may be being put there to create some semblance of privacy. But you're right, I don't have the exact measurements, but it's probably too many beds per square feet. And there's not enough space in here. So there's just, it's very cramped, and, and also the paint on the walls. Yes, somebody just mentioned that the paint on the walls looks bad. They need to, create that space. And for me as well, I think that those items are bookshelves, so they appear to be using bookshelves in place of dressers. So this goes back to us, wanting to use furniture as appropriate. Someone also mentioned that looks like there's no bed frame, like these might just be mattresses on the ground. So, we want to have people have real beds. So again, these are just things like, this is again an extreme example, but we want to make sure that when we're planning out our bedrooms, that we're giving things a little bit more space, using things more appropriately. And again, this doesn't look like a bedroom that I would want to sleep in. So we'd have to make things, yeah, somebody said not at all inviting. That's correct. So we want our bedrooms and spaces to be inviting and home-like. So, all right. And so for bathrooms, we already discussed we need 1 sink, toilet, and shower for every 6 residents. Showers need to have appropriate curtains or doors. So no using like a tarp or something not made for the purpose as a shower curtain. And if the shower door is broken, it needs to be repaired, put a new one on. And also the bathroom should have an appropriate door. Most commonly, we see a situation where there's a house was built to kind of have an owner suite where there's a bedroom and then an in-suite bathroom, and then there might not be a door there. And so if that's somebody's single bedroom and that's their private bathroom, then fine. But oftentimes those rooms are big enough to hold 2 residents. And so you turn it into a double room, and now you've got 2 people with this bathroom with no door to it. We would make you put in a door. Because just to have a trauma-informed environment, people should be able to close the door to use the bathroom and have privacy in the bathroom. And you can say all you want that residents don't care, whatever, but just for that trauma-informed environment, you want to put up that door to the bathroom so that way, residents can have that privacy. Or the other option for those situations, again, if that's their bedroom and they can close the door, to their bedroom, then they can feel safe using the bathroom. And then as well, too, when you're looking at different types of buildings, avoid buildings where there are institutional style bathrooms that might be more appropriate in a prison setting or in a gym setting, or things where you've got like the row of all of the shower heads, and there's no personal shower space and no privacy. We want bathrooms to be safe and home-like. So really just avoid those types of buildings, or consider ways that you can remodel them to make them, a more appropriate, bathroom, or putting in walls in between the showers, or things like that you can do to make them, more trauma-informed. People feel like they've got more safety and they can have privacy when they're showering or using the bathroom. And windows. So windows should be in good repair. So make sure you check out all that. They need to be clean. And then curtain or blinds that are appropriate and in good repair. One of the #1 things we see is recovery home residents, they get the morning sun, they don't like it, so they put up like a blanket or a towel or something on the window to block the light. Neighbors hate that, and it doesn't matter what all the other neighbors in the neighborhood do, but if a neighbor, they call us and like, oh, they put all these random things up in the windows and it looks terrible. So it's a good neighbor thing to say, if you are gonna have, blinds or something on the windows, that they be appropriate, that they be built for that purpose. And so if you're buying blinds, for certain bedrooms, we recommend either getting ones that are thicker so they block the light. Sometimes those thin white vinyl vines don't block the light and it still gets very bright in the room and you're tempted to put up a towel, or you can get the window, the darkening curtains so residents can close those and they look appropriate, and then they're not woken up at 5 a.m. in the summer when the sun comes in. So just, again, something to consider as you're, looking at the recovery residents and what you might need to do. You might need to put appropriate curtains on windows. And then laundry. You can choose to either have residents have laundry on site. This is what every single recovery home we've seen so far has done. They get a washer and dryer and they have it on site. But it's also acceptable if residents have access to a laundromat and it's typical for the neighborhood. And so if you are within a neighborhood where there's a central laundry room station and residents have access to that, that's fine. But it needs to be like something typical that everyone in that community does. And so they can go and do their laundry there. or if there's a laundromat, down the street and everyone on the block uses that laundromat, you need to make sure that they can afford to use it. So whether that's, residents can afford to use it, or residents who can't afford it, they can get tokens or something from you. We just want to make sure people have access to keep their clothes clean, and their linens clean and all of those things. But like I said, so far, it really is just easier just to get the washer and dryer within the home. So as you're looking for a home, make sure it's got a hookup for one, or you can figure out a way to have laundry. And then we're looking at the walls. You want to make sure walls are free from holes, paint is in good condition, and there's no overloaded electrical outlets, and extension cords are being used appropriately. So especially as you're looking to either purchase a home or lease a home, this is a good tip, is really to go around, especially in the bedrooms, and look at electrical outlets. See, are they 2-prong or 3-prong? Because you're going to have residents come in and they're going to have cell phones, tablets, computers, 8 million other things that they're going to want to plug in. And if you have a double bedroom that only has one outlet in it, you're going to have a problem, especially if that one outlet is like a 2-prong outlet, right? So you might really, especially as you're looking at older homes, look at the electrical system. Does it need to be updated? Definitely want to look at that. And then just knowing that your residents are going to have a lot of stuff in their bedrooms, that you want to make sure that the bedrooms are equipped for that as well. And extension cords are used appropriately. So we don't want to see extension cords snaking across like the entire room where it's a trip hazard, or you being used to bring power from one room to another, or like going across the entryway of a doorway. So, so if residents are using extension cords, they need to use them appropriately. And we also don't want to see extension cord connected into extension cord connected into extension cord. That creates a fire hazard, and so we don't want to see that either. And then take a look at the ceilings, and this is another common one. All light fixtures have appropriate covers. And so if you look at this picture here, there's a ceiling fan, and it looks like there's supposed to be a globe or something over that, the light part of the fan. So if you go around the house and you notice, like, hey, there's just exposed bulbs. There are places where somebody took down the cover to replace the light bulb and they never put the cover back. We're going to ask you to cover that, to get a cover and to put that cover over that light bulb. So, so just make sure that all of those light fixtures have appropriate covers. There's no wires hanging from the ceiling. So if you removed a light fixture or a fan or something, and the hole and the wires are still there, we're going to ask you to put an appropriate cover over that and to cover it. We also don't want to see any damage, holes, or leaks in the ceiling. So we don't want to see a ceiling that's leaking, and we also don't want to see all this damage from a previous leak that's still sitting in the ceiling. Like that, it's unattractive, it's unwelcoming, and it could potentially lead to other issues. So we want to see any damage or things like that that are in the ceiling, that they're repaired. And we do get questions about cameras frequently. And the National Alliance of Recovery Residences does not specifically address cameras within the quality standards. And so therefore, it's up to us as the states to determine what's acceptable on a state-by-state basis. And the ORH Board of Directors is currently finalizing a specific policy that specifies levels of support with regards to cameras. And so I know that's not very helpful for you right now, but I don't want to provide you with advice and then have it be changed later with the Board of Directors. So in the meantime, some general best practice information that's based on the NARR standards. So first of all, outdoor cameras, homes have those all over the place. So outdoor cameras are definitely permitted. If you want to have one of those Ring doorbells or things that just look at the outside of the property, that's certainly permitted, and that's not going to change. Those are extremely common in individual residential homes. And then when it comes to indoor cameras, I just encourage you to think thoroughly about the national standards when it comes to home-like environment, a trauma-informed environment, and resident privacy. And so really just think about, is my use of cameras more institutional, or is it, something that any general family would do? would I feel okay putting a camera in this place in my own personal home, knowing that someone could look at it? And then also being a trauma-informed environment. Think about that when it comes to privacy and practices around who has access to camera feeds, especially when you're thinking about it's a women's house. Are you preventing, male staff members or other men from having access to the camera footage or feeds from a women's home? And certainly resident privacy. How are you protecting resident privacy and making sure that the feeds and the footage are appropriately protected? So that's kind of the guidance I can give you now, is to consider those items as you are considering cameras, and to hold on tight, because the ORH board is currently working through a more specific policy for on security cameras being placed in common areas within the inside of the home. And another common question we get is, can bedrooms be in basements? And yes, they can, but you need to ensure you have an appropriate egress. This is especially true for people buying existing properties that are older. Those properties, the owners may have turned a room in the basement into a bedroom, and they may be calling it a bedroom, but it may not actually meet the building code standards for bedrooms. And because single family homes don't have to get a certificate of occupancy, no one's going to come in and tell them otherwise, right? But you, as a recovery housing operator, need to follow all the state and local building codes. And so each bedroom is required to have a secondary egress. And so you need to look into your building code to make sure that whatever egress is identified is appropriate and meets the code. So whether that's an escape window that meets your local codes for what an egress window should be, or if there's another door or something of that nature within the basement, it needs to meet that definition of being that secondary egress in order for it to be a sleeping area. And in general, it's got to be something where if the stairs are on fire, that resident's got to be able to get out of that space. And particularly, what's going to catch on fire? The furnace. So if the furnace is on fire, or the stairs are on fire, how do they get out? Because they'll need a safe way to get out of the basement. And that's our biggest thing, is keeping, following all the building codes, but certainly keeping people safe. And then finally, we get questions about, can you lease a property versus purchasing one? And yes, you can lease a property. People all the time lease a property to operate a recovery home. And some recommendations, if you're considering leasing a property, is that you get legal advice on your lease agreement, and one that is very clear about the responsibilities of the landlord. And so for us, sometimes we go into a property, it's in disrepair, the roof, there's ceilings that have leaks or something that need to be repaired. It's a big, expensive repair. And people say, well, we're leasing the property, that's the landlord's responsibility, which that might be true, but we would not be able to certify that house until that repair is made. So if you have a landlord who is going to drag their feet and not make repairs and not do things for you, then your certification might be at risk, because for us, we just need to see that it's done. And saying, well, it's my landlord's responsibility, my landlord's not doing it, isn't a good enough excuse for us. We need to see that it gets done. So our recommendation is to be very clear in your lease about how you can request repairs or things be made, how soon they need to be addressed, and to make sure that you've got a good system in place to hold them accountable, because you don't want to lose your certification because something happened to the property that was the landlord's responsibility and the landlord didn't address it, and now you're on the hook for your certification. And of course, you also need to be sure the landlord knows the purpose of renting the property. So they know that you are renting the property or leasing the property, and that you're going to be operating a recovery home, for that property, and you have documentation that they are aware that that's what you're using the property for. And so after all of this, I know it's a lot, so I just want to point out some of the most common small issues that need to be addressed so that we can be crystal clear on what's required. Just again, to reiterate these basic things that we often see. So first, smoke detectors need to be included in each bedroom. Having one in the hallway outside the bedrooms is not enough. If we see that, you will be required to put them in all bedrooms. Broken furniture that is in your recovery home will need to be discarded or repaired. And so if we see broken dressers, tables, etc., we will make you either, replace them, with something that works or repair them. We will also make you get rid of any broken furniture that's just being stored places. So like if you just pile up broken furniture in the basement or in the laundry room or something, we're going to ask you to get rid of it. If it's not being used, it's not functional, it's broken, it's trash, and it should be discarded or repaired and made usable. We're also going to ask you to clean the bathroom before we get there. That's one of those things we want to see, that bathrooms and kitchens are clean. And so if we arrive and we see that the bathroom is disgusting, that's going to cause some questions about your management of the home and whether or not all of your policies and procedures are being implemented. Because if you're not fully implementing your policies and procedures around chores, are you also not fully implementing other policies and procedures? So a good tip is to, again, get that chore checklist going, make sure bathrooms are clean, there's supplies for hand washing, all of that is available. Also, we count the number of beds in the bedroom, and that is the number of beds that is permitted to be there by space. So if you have a bedroom that is 70 square feet, that is enough for one person. If you have a set of bunk beds in that bedroom, we will make you take that out and put in a single bed. It does not matter if you weren't using the top bunk, or if that's just an extra place that you're putting the bed, we count that number and we will make you remove that excess furniture. So do not place quote unquote extra beds in bedrooms. And then, we talked about windows, make sure people aren't using blankets or towels as curtains. It's a common thing. We're going to ask you to take them down. And then, for residents who get annoyed, you're going to have to put up like different blinds or curtains that block the sunlight. And then do not have indoor furniture outside. Don't bring an old sofa outside, and especially office chairs for some reason. We see a lot of office chairs being brought outside. Don't do that. Get appropriate furniture that's made to be outside. And then finally, again, back with the common space, make sure there's enough common space. There's a lot of homes out there that were built for some reason with an extremely tiny kitchen and no dining room. Avoid those homes if you're looking for a home to lease or purchase, because we won't be able to certify it if you don't have that common space for people to gather together and eat together. We definitely want to see that common space. It's part of the NARR standards. All right, so I'm gonna go over our questions here. I have a question here: can the home be responsible to pay? I'm assuming that you're talking about repairs needed for a property that you're leasing. And that's again where you're going to want to get an attorney to carefully review your lease agreement with the landlord. So it's very clear what is the landlord's responsibility to pay for repairs and things, and what would be your responsibility. So that way, like whose responsibility is whose. Oh, you're talking about the laundry. And yes, if you are, for laundry, if you are having residents use a laundromat and you are primarily serving residents who have experienced homelessness and have no income, they have no income to go use the laundromat. So they're not going to. And so for those residents, you might get them tokens or something else for them to use, so that way they can have their clothes cleaned. Or if and then maybe once they have a job, once they have the ability to pay for their own laundry, they could do that. But certainly if there's if you're expecting people to go out and pay to do their laundry and your residents have no income, that doesn't count as access. So that's why I think, almost all of our recovery homes provide a washer and dryer for residents to use, because it just eliminates that headache of making sure that they're able to use the laundromat. So, all right, I am not seeing any other final questions, and we just have a couple of minutes left on our time together today. So thank you all for for joining us for the survey. We really appreciate it. Or joining us for the webinar. We appreciate it. We will be sending out that survey to your email after today's webinar. Please complete it. It helps us create better webinars. And if you have any further questions after today's webinar, you can reach out. Our website is there. Our emails are on the website. All those emails come through to me, so you can go ahead and email me there. And I hope to see you on future trainings in this series. So have a great afternoon. Stay warm and stay healthy, everyone.